So I first want to start off by saying this is probably going to be like one of the longest episodes so far I've made on any type of depression. When I first started researching this type of depression, I quickly realized that manic depression isn't called that anymore. And in the last 2 decades, the medical world, especially in the field of psychiatry, has intentionally made a shift from using manic depressive disorder or manic depression to describe bipolar disorder. And due to this, there is a lot of different things and stuff to go over when it comes to bipolar disorder. So let's go ahead and dive straight into it. First, I want to share with you 2 different reasons why the healthcare system decided to change the name and the way they described bipolar disorder. The first one is because the healthcare providers used to use manic depression to describe a wide range of mental health conditions. So throughout the years, the classification systems have become more sophisticated, and the new term bipolar disorder allows for more clarity in diagnosis. And there's a lot of stigma and negativity associated with the terms manic or mania, especially due to the use of maniac. So similarly, people use the term depression casually to describe there are periods of sadness that actually don't associate with a clinical depression. So using bipolar disorder starts to take the focus away from their 2 words. So bipolar disorder is more of a clinical medical term and is actually less emotionally loaded than using manic depression. So of course we're going to start at the beginning of, well, then what is bipolar disorder? It was formerly called manic depression and is a mental health condition that causes extreme mood swings that include emotional highs and lows. When you become depressed, you may feel sad or hopeless and have loss of interest and pleasure in most activities. When your mood shifts to mania or hypomania, you may feel euphoric, full of energy, or unusual irritability. These mood swings can affect sleep, energy, activity, judgment, behavior, and the ability to think clearly. Episodes of mood swings may occur rarely or multiple times a year. While most people will experience some emotional symptoms between episodes, some may not experience any at all. Although bipolar disorder is a lifelong condition, you may manage your mood swings and other symptoms by following a treatment plan, which is going to bring us into then what can cause you to have bipolar disorder. Now, scientists don't yet know the exact cause of bipolar disorder. They do believe that there is a strong genetic component. Bipolar disorder is considered one of the most heritable psychiatric conditions. More than 2/3 of people with bipolar disorder have at least one close biological relative that has the condition as well. However, just because you have a biological relative with bipolar disorder does not necessarily mean you will develop it. Other factors that scientists think contribute to developing bipolar disorder includes changes in the brains, which researchers have identified subtle differences in the average size or activation of some brain structures in people with bipolar disorder. However, brain scans cannot diagnose the condition. And environmental factors like trauma or stress. A stressful event such as a death of a loved one, a severe illness, divorce, or financial problem can trigger a manic or depressive episode. Because of this, stress and trauma may also play a role in developing bipolar disorder. Now again, you may realize that with a lot of the different mental health disorders we will go over, some of them do have similar factors of what scientists and doctors think go along with it. A lot of them have changes in the brain, and a lot of them are environmental factors like trauma and stress. So this is why it's very important for you to talk to your doctor about exactly what's going on, the symptoms you're having, and everything associated with it, so they can actually diagnose you with the correct mental health illness. So scientists are currently performing research to determine the relationship that these factors have in bipolar disorder, how they may help prevent its onset, and what role they may play in its treatment. So of course we're going to go into the signs and symptoms of bipolar disorder, which there are now 4 different categories you could be categorized in depending on which bipolar disorder you're suffering from. The first one is bipolar 1 disorder. This one, you have at least one manic episode that may be preceded or followed by hypomanic or major depressive episode. In some cases, mania may trigger a break from reality. The next one is bipolar 2 disorder. In this one, you may have at least one major depressive episode and at least one hypomanic episode, but you've never had a manic episode. The next one you could be diagnosed as a psychothermic disorder. This one, you've had at least 2 years or 1 year in children and teenagers of many periods of hypomania symptoms and periods of depressive symptoms. And other ones that you could have are just other types that include, for example, bipolar and related disorders induced by certain drugs or alcohol or due to a medical condition such as Cushing's disease, multiple sclerosis, or a stroke. So the defining signs of bipolar 1 disorder is a manic episode that lasts at least 1 week, while people with bipolar 2 disorder or psychothermia experience hypomanic episodes. But many people with bipolar disorder experience both hypomanic and manic and depressive episodes. These changing mood states don't always follow a pattern, and depression doesn't always follow a manic patterns. A person may also experience the same mood state several times with periods of athermia in between before experiencing the opposite mood. Mood changes in bipolar disorder can happen over a period of weeks, months, and sometimes even years. An important aspect of the mood changing is that you're a departure from your regular self, and the mood change is sustained for a long time. It may be many days or weeks in the case of manic, and many weeks into months in the case of depression. The severity of depression and manic phases can differ from person to person and in the same person at different times. So there are different symptoms and signs for each manic, hypomanic, depressive episodes, and mixed episodes. So let's identify each one. The first one we're going to start with is manic episodes. Some people with that bipolar disorder will experience a manic or hypomania many times throughout their life. Others may experience them only rarely. So the signs that come with that is excessive happiness, hopelessness, and excitement. Sudden or severe changes in mood, such as going from being joyful to being angry and hostile. Restless, rapid speech and racing thoughts, increased energy and less need for sleep, increased impulsivity or poor judgment, such as suddenly quitting your job, making grand or attainable plans, recklessness, and risk-taking behavior such as drug or alcohol misuse, or having unsafe or unprotected sex, feeling like you're unusually important, talented, or powerful. And last, psychosis is when you experience hallucinations and delusions. Most of the time, people experience a manic depression are unaware of the negative consequences of their actions. With bipolar disorder, suicide is an ever-present danger. Some people become suicidal in manic episodes, not just depressive episodes. If a person is having an intense manic episode, especially if they're experiencing hallucinations and delusions. They may need to be hospitalized to protect themselves and others from possible harm. The second one we're going to talk about is hypomanic. Some people with bipolar disorder have milder manic-like symptoms. This is called hypomanic. With hypomanic, you may feel very good and find that you can get a lot done. People with hypomanic can often function well in social situations or even at work. You may not feel anything is wrong during a hypomanic episode, but your friends and family may notice your mood swings and activity levels change and that they're unusual for you. After hypomanic, you may experience severe depression. The next one we're going to talk about is depressive episodes. The symptoms you're going to feel with those is overwhelming sadness, low energy and fatigue, lack of motivation, feelings of hopelessness or worthlessness, loss of enjoyment of things that were once pleasurable for you, difficult concentrating, making decisions, uncontrollable crying, irritability, increased need for sleep, insomnia or excessive sleep, a change in appetite causing weight loss or gain, and last, thoughts of death and suicide. And of course, I've said this, I think in every episode I've talked about mental health, is that if you are experiencing any symptoms and you start feeling suicidal, please seek help immediately. Do not wait until it is too late, and do not think that you have it under control, because most of the time you do not, and you do need to seek help. The last one we're going to talk about is mixed emotions. The symptoms of mixed emotions include both manic and depressive symptoms together. During a mixed episode, you have negative thoughts and feelings that come with depression, but also feel agitated, restless, and high energy. People who experience mixed emotions often describe it as the worst part of having bipolar disorder. Before we move on, I'd like to talk about how children and teens could experience bipolar disorder. Now, symptoms of bipolar disorder can be difficult to identify in children and teens. It's most often hard to tell whether they are normal ups and downs or the result of stress or trauma, or if it's a sign of a mental health problem other than bipolar disorder. Children and teens may have distinct major depressive or manic or hypomanic episodes, but the patterns can vary from that of adults with bipolar disorder. Any mood can rapidly shift during episodes. Some children may have periods without mood symptoms between episodes. So the most prominent sign of bipolar disorder in children and teens includes severe mood swings that are different from their usual mood swings. So I think I've said it before that no matter what mental health illness your child or teenager could be suffering from, it is just very important to pay attention to how your kids are doing. Always be open and tell them they can openly talk to you about anything, about what's going on with them, friends, school, family, anything. So then you always know what's going on with them, and if they do start acting weird or having mood swings or acting out, then that's another sign for you to say, okay, wait, what's going on? And if it keeps happening and isn't getting better, it may be time to reach out to your doctor and figure out what's actually happening. So now we're going to talk about how you could get diagnosed with bipolar disorder, and your health care provider may use many tools, including a physical exam, a thorough mental history, which is going to include asking about your symptoms, lifetime history, experiences, and family history, medical tests such as blood tests to rule out other conditions that could be causing your symptoms, such as hyperthyroidism, and a mental health examination. Your healthcare provider may perform the examination, or they may refer you to a mental health specialist such as a psychotherapist or psychiatrist. To be diagnosed with bipolar disorder, you may have experienced at least one episode of manic or hypomanic. To determine what type of bipolar disorder you may have, your mental health provider assesses the patterns of symptoms and how they may affect your life during the most severe episodes. People with bipolar disorder are more likely to also have the following medical conditions, such as anxiety, attention deficit / hypoactive disorder, which is ADHD, post-traumatic stress disorder, which is PTSD, or substance use disorder / digital diagnosis. Because of this, as well as the fact that the memory is often impaired during mania, some people cannot remember experiencing it at all. It can be difficult for a healthcare provider to properly diagnose people with bipolar disorder. People with bipolar disorder who are experiencing a severe manic episode with hallucinations may be incorrectly diagnosed with schizophrenia. Bipolar disorder can also be misdiagnosed as borderline personality disorder. Because of this, it's important to be honest and thorough when explaining all your symptoms and experiences when talking to your healthcare provider. It can also be helpful to include a loved one who might be able to provide additional information about your mental health history in your discussion with your provider. So just remember that no matter what you're struggling from, to always be open and honest and give full details about what's going on with you and what you're experiencing, so then you're diagnosed with the proper diagnosis, so then you can get the treatment and the medication that are correct for what you're going through. So of course, now let's talk about the treatment. Treatment can help people, including those with a most severe form of bipolar disorder. An effective treatment plan usually includes a combination of the following therapies: psychotherapy, medication, self-management strategies like education and identifying the early symptoms of an episode to possible triggers of episode, helpful life habits such as exercise, yoga, and meditation. These can support but not replace your treatment. And lastly, other therapies as electroconvulsive therapy in cases that are poorly responsive to medication or where rapid control of symptoms is necessary to prevent harm. So bipolar disorder is a lifelong condition, so treatment is a lifelong commitment. It can sometimes take several months into years before you or your health provider find a comprehensive treatment plan that works best for you. Although this can be discouraging, it's important to continue treatment. Episodes of mania and depression typically come back over time. Between episodes, many people with bipolar disorder do not have mood changes, but some people may have lingering symptoms. Long-term continuous treatment that can help manage these symptoms. If you have other mental health conditions in addition to bipolar disorder, such as anxiety or ADHD, it can be more difficult to treat the conditions. For example, the antidepressants healthcare providers describe to treat obsessive compulsive disorder and the stimulants that they prescribe to treat ADHD may worsen symptoms of bipolar disorder and may trigger a manic depression. Again, even though it may be difficult to treat these conditions, it's not impossible. Be sure to stay committed to finding a treatment plan that works for you. So that's why I said it's very important when talking to your doctor about what you're going through and the symptoms you're having to be very thorough on what is going on, because if you're diagnosed with something that you do not have and you start taking antidepressants and going through these treatment plans to fix what they think you have, it could just make what you actually have very worse, because the treatment that you're getting and the medicine you're taking isn't going to work for exactly what you're going through. So be very thorough when telling your doctor what's going on, and again, having somebody who has been around who can say this is what they're experiencing and this is what they're going through is going to help you too, because it helps pinpoint again exactly what you're going through, the treatment you need, the medication you need, therapist you need to talk to, and the right treatment plan just overall to help you through what you're going through to make your daily life better. Which is why I would like to talk about what the outlook of having bipolar disorder looks like. The prognosis for bipolar disorder is often poor unless it's properly treated. Many people with bipolar disorder who receive appropriate treatment can live fully and productive lives. Bipolar disorder results in approximately 9 years reduction in expected lifespan, and as many as 1 in 5 people with bipolar disorder commit suicide. As established, 60% of all people with bipolar disorder have drug and alcohol dependencies. This is why it's essential to seek medical care and stay committed to your treatment plan for bipolar disorder. Regular and continuous use of medication can help reduce episodes of mania and depression. By knowing how to recognize the symptoms and triggers of these episodes, there is a better chance for excessive treatment and finding coping methods that may help prevent long periods of illness, extended hospital stays, and suicide. And the last thing I want to share with you is 6 lifestyle changes that can help stop patterns of the behavior that worsen the symptoms of bipolar disorder. So some of these lifestyle changes include: number 1, quitting drinking alcohol and or using recreational drugs and tobacco. It's essential to quit drinking and using drugs, including tobacco, since they can interfere with medications you may be taking. They can also worsen bipolar disorder and trigger a mood episode. The second one is to keep a daily diary or mood chart. Keeping track of your daily thoughts, feelings, and behaviors can help you be more aware of how well your treatment is working and or help you identify potential triggers of manic or depressive episodes. I know I'm going to say it again because I know I've said it in other episodes when we talk about it. Journaling every day and just jotting down how you're doing and how you're feeling is just going to help you so much, again, to identify your possible triggers or to just keep track on how you're doing and how your medication is and how you're feeling. The third one is to maintain a healthy sleep schedule. Bipolar disorder can greatly affect your sleeping patterns, and changes in your frequency of sleep can even trigger an episode. Prioritize a routine sleeping schedule, including going to sleep and getting up at the same time every day. Number 4 is to exercise. Exercise has been proven to improve your mood and mental health in general, so it may help manage your symptoms related to bipolar disorder. Since weight gain is a common side effect of bipolar disorder medications, exercise may also help with weight management. Number 5 is medication. Medication has been shown to be effective in improving the depression that's part of the bipolar disorder. And last is to manage your stress and maintain healthy relationships. Stress and anxiety can worsen mood symptoms in many people with bipolar disorder, so it's important to manage your stress in healthy ways and try to eliminate stressors when you can. A big part of this is maintaining healthy relationships with people who add stress in your life. So I seriously, guys, I research these topics and these different mental health disorders so I can go over them with you. And as you're learning through these episodes about what each one is and the symptoms and the diagnosis and the treatments about them, I'm learning as well. And I'm so surprised, I guess, on like how many like different things can like actually be very similar to other like illnesses. So I love doing these episodes and I love like researching and putting these episodes together for you guys, but not only for you, for me. I love learning more and more about every mental health illness and what is associated with it and how people live with it and the things that we can do to make our lives better. Because no matter what you're struggling with, no matter what mental health disorder you have, it's so important to learn as much as you can about what it is and how it affects you every day. The more education you can have about it, the easier it's going to be for you to understand, and the easier it's going to be for you to tell your friends and family what's going on with you and how they can help with your daily life and improving what you're going through. Again, this was probably like the longest episode I've ever done on a mental disorder so far, because there was so much that went into having bipolar disorder and how much like different things go into it, and how you can be described as having bipolar 1 or bipolar 2 or everything that just like goes into it. And when I was writing this episode out, I was like, wow, like I have 6 pages of information that I want to share with you guys. And I just kept thinking to myself that somebody is going to listen to these episodes and they're either going to learn something they never learned, or they're going to learn more about the mental health illness they have. Because I think for a lot of people, when we go to the doctor or we talk to a therapist and they tell us this is what we're suffering from, most of the time we either don't know what it is, we're not educated in it, we've never heard of it before. And I don't know if a lot of times, I'm assuming that a lot of times when you're diagnosed with something, you like research the crap out of it just to make sure you know exactly what it is and exactly what it's associated with and how it's going to make you feel. But I think sometimes we don't. We're just like, oh, okay, I have depression. Well, what medications can I take? And now, do I talk to a therapist? Like, how do I make it better? Like, how do I stop feeling the way I feel? And we don't educate ourselves enough to say, okay, these are the signs and symptoms, and this is what I'm going through, and this is how I treatment, and this is how it can be diagnosed, and this is how I can make myself feel better. And I just think if we were more educated, not just for people who have it, but for people who might know somebody who has it or might just need to be more educated in these areas, it's so important for everybody to know what's going on. It's so important for people to feel like they can talk about their mental health illness without being judged or told that that's not what they're feeling, and for people just to feel alone. Ultimately, I don't want people to feel alone. I don't want you to feel like you have to suffer alone and not say anything and just sit quietly. I want you to feel like you can openly talk to somebody. And like I've said before, if you don't feel comfortable opening up to a friend or family member and you're feeling the way you feel, talk to a therapist, talk to a doctor, because you need to let somebody know what's going on with you. You need to let somebody know how you're feeling. Because as much as I hate to say it, it does happen that people don't open up and they don't talk about it and they take their own lives, and it's just sad. So please reach out to somebody if you're suffering. Please make sure that you're doing the things that you need to do to better your life and to better educate yourself and just to live a happy and healthy life going forward. I truly hope this episode was eye-opening for you, because it was eye-opening for me, and can just help somebody out there who either has it or knows somebody who has it, to help them just get more educated so they know what's going on with that person and they know how to help. Like always, I want you guys to know that you are never alone and that I love you.